Understanding diabetes, type 1 versus type 2. Diabetes is a chronic condition that affects how your body regulates blood sugar, also known as glucose. It is a complex and multifaceted disease that requires careful management and understanding. The two main types of diabetes, type 1 and type 2, have distinct causes, symptoms, and treatments, making it essential to differentiate between them for effective care. Glucose is your body's primary energy source, and it comes from the food you eat. When you consume carbohydrates, they are broken down into glucose, which enters your bloodstream. This glucose is then transported to your cells to be used for energy, allowing your body to function properly. A hormone called insulin, produced by the pancreas, helps transport glucose from your bloodstream into your cells to be used for energy. Insulin acts as a key, unlocking the cells to allow glucose to enter. Without insulin, or if the body cannot use insulin effectively, glucose builds up in the bloodstream, leading to high blood sugar levels. In diabetes, this process is disrupted. There are two main types of diabetes, type 1 and type 2. Each type has its own unique mechanism that leads to high blood sugar levels, and understanding these mechanisms is crucial for managing the disease effectively. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This autoimmune reaction means that the pancreas can no longer produce insulin, leading to a complete dependence on external insulin sources. This type of diabetes is usually diagnosed in children and young adults, but it can occur at any age. This means people with type 1 diabetes cannot produce insulin and require daily insulin injections to survive. These injections help to maintain blood sugar levels within a normal range, preventing the dangerous complications associated with high blood sugar. Type 2 diabetes is different. In this case, the body becomes resistant to the effects of insulin, or the pancreas doesn't produce enough insulin to maintain normal blood sugar levels. This type of diabetes is often associated with lifestyle factors such as obesity, physical inactivity, and poor diet, and it tends to develop gradually over time. This type is far more common than type 1 diabetes, accounting for about 90 to 95% of all cases. It is often diagnosed in adults, but increasing numbers of children and adolescents are being diagnosed with type 2 diabetes due to rising obesity rates. Understanding the difference between these two types is crucial for proper diagnosis and management. While both types require careful monitoring and management of blood sugar levels, the approaches to treatment can vary significantly. Type 1 diabetes management focuses on insulin therapy, while type 2 diabetes management may include lifestyle changes, oral medications, and sometimes insulin. While both types share the problem of high blood sugar, their causes and treatments differ significantly. By understanding these differences, individuals with diabetes and their healthcare providers can work together to develop effective management plans that address the specific needs of each type, ultimately improving health outcomes and quality of life. The rise of type 2 diabetes. Type 2 diabetes is a global health concern, and its prevalence has been rising at an alarming rate over the past few decades. Millions of people worldwide are currently living with this condition, and the numbers are projected to increase significantly in the coming years. This surge in type 2 diabetes can be attributed to a complex interplay of factors, including aging populations, genetic predisposition, and lifestyle changes. However, the most significant contributor to this epidemic is the increasing prevalence of obesity and physical inactivity. The good news is that type 2 diabetes is often preventable. By understanding the risk factors and making healthy lifestyle choices, we can significantly reduce our chances of developing this condition. Unraveling the causes. Why me? Type 2 diabetes arises from a combination of genetic and lifestyle factors. While we can't control our genes, understanding our risk profile empowers us to make informed choices. Family history plays a significant role. If you have a parent or sibling with type 2 diabetes, your risk increases. Certain ethnicities, including African Americans, Hispanic Americans, American Indians, and Asian Americans, are also at a higher risk. Lifestyle choices are equally important. A diet high in processed foods, sugary drinks, and unhealthy fats, combined with a lack of physical activity, significantly increases your risk. Other factors can also contribute, including certain medical conditions like polycystic ovary syndrome, or PCOS, and gestational diabetes, some medications, and prolonged stress. Understanding these risk factors is the first step towards prevention and management. Recognizing the red flag symptoms of type 2 diabetes. Type 2 diabetes often develops gradually, and many people may not experience any noticeable symptoms in the early stages. This can make it particularly challenging to diagnose and manage early on. The subtlety of the symptoms often leads to a delay in seeking medical advice, which can result in the condition worsening over time. This is why it is often called a silent killer. The lack of early symptoms means that many people may be living with the condition for years without realizing it. During this time, high blood sugar levels can cause significant damage to various organs and systems in the body. However, as the condition progresses, certain telltale signs may emerge. Increased thirst and frequent urination are common early symptoms. These symptoms occur because the body is trying to get rid of the excess glucose in the blood by flushing it out through urine. As blood sugar levels rise, the body tries to flush out the excess glucose through urine, leading to dehydration and increased thirst. This cycle of drinking more water and urinating more frequently can be exhausting and disruptive to daily life. Other symptoms include unexplained weight loss, increased hunger, fatigue, blurred vision, slow-healing sores or cuts, and frequent infections. Unexplained weight loss can occur because the body starts to break down muscle and fat for energy when it can't use glucose properly. These symptoms result from the body's inability to utilize glucose effectively for energy and the damaging effects of high blood sugar on various organs. Fatigue and increased hunger are common because the body's cells are not getting the energy they need, despite high levels of glucose in the blood. If you experience any of these symptoms, it's essential to consult your doctor for a proper diagnosis. Early detection can make a significant difference in managing the condition and preventing long-term complications. Early detection and treatment are crucial in managing type 2 diabetes and preventing complications. By working closely with healthcare professionals, individuals can develop a comprehensive management plan that includes lifestyle changes, medication, and regular monitoring of blood sugar levels. This proactive approach can help maintain a good quality of life and reduce the risk of serious health issues associated with type 2 diabetes. Diagnosis: taking the first step. Diagnosing type 2 diabetes involves a simple blood test to measure your blood sugar levels. This initial step is crucial as it helps in identifying the condition early, allowing for timely intervention and management. Early diagnosis can prevent or delay complications associated with diabetes, such as heart disease, nerve damage, and kidney issues. Your doctor may recommend one or more of the following tests to get a comprehensive understanding of your blood sugar levels and overall health. These tests are designed to provide a detailed picture of how your body is processing glucose, which is essential for determining the best course of action. The fasting plasma glucose test measures your blood sugar level after an overnight fast. This test is often the first step in diagnosing diabetes because it provides a clear indication of how your body manages blood sugar without the influence of recent meals. A normal fasting blood sugar level is less than 100 milligrams per deciliter. If your levels are higher, it may indicate prediabetes or diabetes, prompting further testing and evaluation. The oral glucose tolerance test measures your blood sugar levels before and 2 hours after drinking a sugary drink. This test helps to understand how efficiently your body processes glucose over a period of time, which is crucial for diagnosing diabetes and prediabetes. This test helps determine how well your body processes glucose. If your blood sugar levels remain high after 2 hours, it may indicate that your body is not using insulin effectively, a hallmark of diabetes. The A1C test provides an average blood sugar level over the past 2 to 3 months. This test is particularly useful because it gives a long-term view of your blood sugar levels, rather than just a snapshot. It reflects the percentage of blood sugar attached to hemoglobin, a protein in red blood cells. A higher A1C level indicates poorer blood sugar control and a higher risk of diabetes complications. Your doctor will interpret the test results and discuss the diagnosis with you. This conversation is vital as it helps you understand your condition and the steps you need to take to manage it effectively. Based on your individual needs and health history, they will recommend a personalized treatment plan. This plan may include lifestyle changes, medication, and regular monitoring to keep your blood sugar levels in check and prevent complications.